Okay. So I also hear that maintaining a good immunity by good diet, sleep, exercise, and stress-free environment is probably key to boosting your immunity to prevent, or even if you get the infection, to control the disease. Beyond that, there are a lot of supplements like dietary supplements, vitamin C and D, and even like home remedies like garlic and turmeric. So do these have a specific role beyond a good healthy diet, and do people need to take these?
Definitely, a good lifestyle is very essential to prevent coronavirus disease. Stress has been shown to lower your immunity levels, definitely. So, a stress free environment, good sleep, taking adequate water, being hydrated helps a long way in preventing the disease, as well as because when you keep hydrating yourself, you don't allow the virus to accumulate to more than a certain quantity in that area. So you keep hydrating yourself and keeping so when you hydrate yourself, you flush out your toxins, so your body immunity becomes better. Good sleep definitely helps to boost up the immunity, because sleep during that time a lot of hormones and those things are released, which help to boost up the immunity. Good diet, definitely. As far as possible, avoid fast foods, and have a especially our Indian diet is a very it's full of vitamins and minerals and all kinds of nutrition, antioxidants. Especially, all our cooking, we use a lot of garlic, turmeric, and all these, our masalas, especially if they are homemade masalas, a lot of antioxidants in that. So when you use a normal diet, that, and as far as possible, take it warm, don't keep it to become cold. So take it warm, fresh food, take fresh food. So that will help us a long way in preventing or even reducing the severity of the disease. But supplements, as far as I know, supplements are of no greater benefit or no added advantage over taking normal diet. But if a patient has any deficiency, they can have vitamin deficiency, B12 deficiency, vitamin D deficiency. So in such cases, definitely adding extra vitamins will help.
Okay. Now let's talk about a scenario when somebody is tested positive. What is that they need to be aware of? Does every COVID positive patient be required to be admitted in the hospital? Now a government order has come saying that potentially some of them could be taken care of at home itself. So who can stay at home? Who needs to go to these so-called COVID first line treatment facility? And who needs to go to a secondary or tertiary care hospital?
So we have categorized them into three categories, A, B, and C. So A is very mild symptoms. So mild symptoms, patients can remain at home. Or there are asymptomatic patients who have been tested because they have come in contact with another person, and during routine screening they have been found to be positive. So those kinds of patients can stay at home. Only problem is, when you stay at home, you have to keep the self-isolation policy in the home. So whoever is positive in the home has to remain in a single room. They shouldn't come out of the room, and they should use a different separate toilet. They can't use the common toilet, and food or everything has to be supplied in the room. The others in the house should also respect this self-isolation policy, and they should have social, there is a social responsibility, and they shouldn't go out, because even if they don't have symptoms, they can be harboring the virus and they can spread the infection. So those in the house should also self-isolate, quarantine themselves to at least 14 days until the other person becomes negative, and naturally the others in the house will also be screened later on for the virus, so until they become negative.
And who needs to go to the first line treatment facility, hospital, and so on?
Okay. To go to the hospital, I think category B. So when they have more severe disease, and category C, definitely they will be hospital because they are very sick. So category B patients, before they become very sick, they have to go to the hospital. They have to go to the testing facility, get themselves tested, and they have to be admitted to a hospital so that they can be treated as needed.
Let's move on to the non-COVID patient issues. A lot of people are literally scared to come to the hospital because they are afraid they will get COVID. And you were telling me a couple of instances when people have sat home and their disease got worse to the extent that when they came to the hospital, they could not be rescued. So what should these patients be aware of? When should they and shouldn't they come to the hospital?
It was few instances that happened to some of my patients and some of the patients of my friends that I came to know that people are more worried about corona than about their own other health issues. I had a patient who was who had diabetic cardiac illness, who was having breathlessness, which was not due to corona. Okay, and I told them to bring, so they said no, corona we will treat at home, and they did whatever they could. And over the phone, that we can only assess a little bit, so whatever I could, I told them what to do, and but I told them to bring the patient. The previous day also they called me. I told them, please bring him, we'll try to do whatever is possible, but they didn't bring. So next day morning when I saw them, they were here in the hospital in the ER, but the patient has already died.
Okay.
He was brought dead
By
to
the
the
time he got to the hospital,
itself, and he was
they
brought
had
dead to the
brought that to the
brought to the
hospital.
hospital.
Okay.
So it could have been something that we could have, it was not a corona case, because the symptoms are definitely not because of that. It was because of a cardiac issue. So few of my friends also told me, some of the non-medical friends, a few days back he told me around his house, 4 or 5 people, not very old, they died because of non-corona disease like cardiac illnesses, because they didn't go to the hospital because of fear of corona. So I think a lot of people, because they don't really understand what this corona is, and they don't really understand the warning signs in their disease, they are remaining at home, and that is causing their lives. So what we need to do is diabetes, hypertension, cardiac illness, renal disease, liver disease patients, I think they should be aware of their warning signs. So if a patient with a pulmonary problem, he has cough and breathlessness, I don't think he should be remaining at home. If they have a pulse oximeter, good, they can check the pulse oximeter. But by and large, I think if his symptoms seem to be worsening, they should approach a uh, emergency department. A cardiac patient, he seems to be having swollen legs and he has breathlessness on walking. They shouldn't wait till he is breathless at rest. So by the time he is breathless at rest, he is gone into pulmonary edema and sometimes even cardiogenic shock, and things may be out of hand. So as soon as they get warning signs, a renal disease patient, he is bloating up and he has swelling in the face, legs, urine output has come down, and slowly is getting breathless. Immediately approach the hospital. Liver disease patient with bloating stomach, bloating legs, he has altered behavior or sleep habits, and he has some abnormal behavior, I think, and he is becoming, his consciousness is waxing and waning. Immediately approach the hospital. So I think more than the corona, I think we should be aware of warning signs in our own diseases, and we need to approach the hospital when we see the warning signs.
Okay. I hear that there is a teleconsultation where you can talk to the doctor either over the phone or through a video conversation. Which kind of patients can make use of that facility?
In this present situation, to prevent overcrowding, I think teleconsultation is a very good choice, especially patients who just need a routine consultation. They can do all their blood tests from a nearby center, and instead of crowding in the hospital, they can consult the doctor over the phone. Small illnesses, a mild fever, for the first time they can consult, where we can give some minor medications. Um, but if the fever doesn't settle down, then I think more teleconsultation is not going to help. They need to approach some hospital. But by and large, I think stable patients who are coming for a routine every 3 months or 6 months, they're coming for a routine checkup, they can do it at home, and they can do a teleconsultation. It is by and large for a new patient, it is preferable not to do a teleconsultation because we really don't know the background of the patient and why his present clinic symptoms are due to. So in such a patient, I think without physical examination, it will be difficult to assess the patient or to give him any proper advice.
Earlier, we were alluding to a quarantine concept where those who are tested positive should stay at home and isolate themselves and so on and so forth. There is also this concept about reverse quarantine for those who are vulnerable. And what is that concept, and who should be in a reverse quarantine?
In quarantine, we put the people who are infected or who have tested positive for the SARS-CoV-2 virus, we isolate them in a facility or at home. In reverse quarantine, we are isolating a person who is likely to get the disease and the disease is likely to worsen. People like people with cardiac disease, uncontrolled diabetes, obesity, liver disease, immunocompromise. So such patients, we don't want them to get the SARS-CoV-2 virus. So we put them first of all into, it's called reverse quarantine. We put them in quarantine so that at home, that they don't come into contact with any other person who is likely to harbor the virus who are symptomatic, so that they don't get the virus at all. So to a large extent, we can prevent the morbidity and mortality by that.
Okay. We were talking about masks earlier and the etiquettes for wearing masks. We see a lot of public using regular gloves when they go out, but they still seem to be kind of touching their mask and touching their face with the same glove throughout the day. What is your advice to people who prefer to wear the gloves, and what is the best way to use it?
Unless you have some skin problems and you are not able to use a sanitizer or keep wash your hand with soap and water frequently, better not to wear a glove, because a glove gives you a false sense of security. Many people feel wearing a glove makes them immune to the virus, and I've seen people in the shops, white gloves now become brown or torn, and they with the same glove they take stuff and give it to people. They take the money, same gloves, and in between, because they feel they are wearing gloves, they don't sanitize it, they don't wash it. On the other hand, if a person is not wearing a glove, they are they are quite concerned and they keep sanitizing and washing. So unless you have a physical ailment which prevents you from using sanitizer or washing your hand frequently, it's better not to wear a glove. And even if you wear a glove, you need to make sure that every few hours a glove is removed and a new glove is worn. And in that glove, the time you are wearing it, you should frequently sanitize it, or you should frequently wash it with soap and water. Otherwise, there is no point.
Okay, thank you. What would be your take-home messages for this audience in this scenario of COVID-19?
In the scenario of COVID-19, it is better that you keep a very mental and physical health, exercise daily as much as possible in your house or around your house. Have a good diet, a balanced diet. Don't overdo anything. Avoid going out as much as possible. If you have any other ailments, when you see some warning signs, immediately consult the concerned doctors, or if in case you feel it is an emergency, it's like a chest pain. Don't call the doctor and ask, should I go to the hospital or not? Because a diabetic patient with a chest pain, or already a cardiac patient with chest pain, we really can't know what is it. So immediately approach some center for help immediately. Then social distancing and hygiene norms that we have to follow. So like social distancing of 6 feet, wearing a mask in public, frequent sanitization of the hands. Then having a very good mental health, because stress can make your immunity go down and to get the disease. So avoid watching unnecessary news and on media as well as social media about COVID, coronavirus disease, which will actually make you more, worried and you fear more, and that is going to make immunity less. So maintain a very healthy lifestyle and a good mental health, and that will help in preventing this disease for large extent.
Thank you, Dr. Bobby, for answering all our questions in a very simple and detailed manner. We really appreciate all your input. Thank you.
Welcome.